Hello everyone. So how all of you? I think all of you are great. And this is a ulna bone. So I would like to discuss about this ulna bone, about features like surface, border. So we will discuss about this ulna bone. As you can see, this is ulna bone, and this is ulna bone, which is typical a long bone and situated medially forearm. So in this way, as you can see, this is situated medially, so this is medially and this is laterally. So laterally it is Persian radius, and medially this is ulna is situated in this manner, you can say, so in this way. So I would like to say about this is typical long bone, and this is homologous to fibula of lower limb. And if I'm talking about this bone have two end, upper end and lower end. And as you can see in the upper end there is a two process. One is olecranon process, this is olecranon process, and this is coronite process. And between olecranon process and coronite process, as you can see, this is a trochlear notch. Now I would like to say about this bone, about surface of the olecranon and coronite process, and also shaft. So let's see about this bone. And if I'm talking about this, this is head of this ulna, as you can see, and this is styloid process, which is situated medially. When I as you can see, this is medially it is situated, styloid process. And so let's see about this bone, about surface of the olecranon process. There are 5 surface of olecranon process. So I would like to show you in the anatomical position all the surfaces of the olecranon process. So when I take this bone in my forearm in medially, because this bone is situated medially, so I put this bone in the medially. And as you can see, there is a trochlear notch, which is there is articulation of humerus bone. So here is humerus bone, and humerus bone there is bicep muscles and tricep muscle, which is located here and origin and inserting into this ulna. So let's see about here actually notch which is articulate with the humerus. Okay, so in this way, if I'm talking about the 4-5 surface of the olecranon, first I would like to say about this surface. This is a superior surface and this is anterior surface. You can see, I just show you, this is superior and this is anterior. So you can see this is medially placed, so this is medial surface, and this is posterior surface. I have also mentioned in pen, black pen, as you can see I have mentioned. So this is posterior, just medial. If I'm going to the medial and below there is downward, and just there is a posterior surface. And now there is a lateral. So I have discussed about the 5 surface of olecranon process. So one is superior, this is superior, and this is anterior, this is anterior, and this is medial. There is 3, and this is posterior, 4 surface, and this here is a lateral. This is a lateral surface. So I think you have understand about, I have told you that's inferior, but here is not inferior, so there is lateral. So I would like to say the another surface of coronite process. If I'm talking about the coronite process, there is a 4 surface of coronite process. One is superior, this is anterior, and this is medial, and in this there is a radial notch. In this here there is a present a lateral surface of coronite process. So you know very well about this is notch, as you can see very well, this is radial notch. Actually radial bone is attached here of the circumference head of the radius is attached. I just show you. So as you can see, this is radius bone, and now how this is circumference of head of the radius, which articulate here in this notch. This is a radial notch, so in this way articulates. And this is a radial tuberosity. There is also a pit here which is articulate in this way, as you can see. And as you can see, the radial tuberosity which is attached here in the pit, and the circumference of the humerus which articulate in the radial notch. So in this manner, which is join in this forearm, but this bone is individual another bone, and this individual bone is another bone. So I'm just try to making you understand how it is articulate. And in this gap, as you can see, there is as you can see here, in this gap there is interosseous membrane attached here with the border of the shaft of two bone, radius bone and ulna bone. In the between there is interosseous membrane present. So I would like to go in the another case of the shaft. So what actually the shaft we are saying, the two in between the two in there is a present shaft. As you can see, this is shaft. And if I'm talking about shaft has a three border and three surface. So I just show you. As you can see, I just make in the black color the surfaces of shaft. As you can see in this here also, and there also I have marked, so you can easily recognize. So when you just grip with your hand this ulna bone, so you easily recognize the border and the surface. So it is also essential to look the video when you understand the we basically understand the which side of this bone and what is the anatomical position. So you will understand when you will touch, when you just touch with your hand bone, and when you feel the surfaces and borders, so you will easily understand that. So when you look about this right now, so when you getting time, so definitely try one time to look by on yourself, that's by with your hand, with your thumb, so you can see very well. So what the surfaces, when you touch the interosseous border of this bone, so you feel that the crest like a structure, this is very narrow, you feel that, oh yes, this is exactly border. So I think it might be unable to figure out very well that how which the border and the surface. So when you touch it will easily understand. So I'm just showing you. As you can see very well, there is the ending point and here is ending point, so definitely this is surface. And when there is a narrow range, this is a border. So I would like to say the shaft has three border and three surface. Okay, so let's see, I just try to show you the three border. So if I'm taking this bone in anatomical position, so in this way I have taken anatomical position. So as you can see, this is a anterior border. What? This is anterior border. I just show you. As you can see, this is anterior border. I have a mention in this black format, anterior border. So it's going the border basically narrow. Okay, so in that way remember, always narrow. And this is anterior border, and this is a interosseous border. This is interosseous border. I think you're unable to see. So you can see this is a interosseous border. So this is interosseous border, which is crest like a structure, or we can also say about this border is lateral border. And as I have already told you, this is anterior border. And if I'm going to the posterior, there will be the posterior border. So I have told you the three border: anterior, interosseous or lateral, and posterior border. Let's see about the surface. So let's see about this bone surface. So if I'm going to anterior and interosseous border, when I'm in between, when I go in the between of anterior and interosseous, this is anterior and this is interosseous border, there is between, there is a anterior surface. Okay, so how we can say the medial surface, when I'm going to the anterior border of the shaft and posterior border of the shaft, between there is a medial border. So you write in this manner, so you can easily recognize very well. So another surface is and posterior border. Basically posterior border, when I will take first posterior border of the shaft and interosseous border of the shaft or lateral border of the shaft, between here we can find the posterior surface of the shaft. So I can easily make you understand very well. This is border, how the area. So always you see that surface has some border, but a border have very less area. So you can easily in this way can distinguish very well. So you have already understand that about this bone external features and all the thing. So you just need to try to understand very well what the anatomical positions of the bone. So when you have features, when you have idea about this bone, so you easily distinguish this bone is a left side and this bone is a right side. So this is ulna, which is basically the left side of this bone, left side. So because this is medially placed, so I already medially placed, and here is articulation trochlear notch, so it is articulate with the humerus, so I can easily identify that yeah, this is bone is a left side. So I would like to thank you to all of you to watching this video. I will come back again in the next video. Thank you.